Good news for the National Football League and the National Football League Players Association. They have self-negotiated themselves some agreements as we get closer to the start of training camp. And look, we know the NFL is a deadline-driven league. My concern was that from the players' perspective, there really wasn't a deadline. Hey, we'll show up. You tell us what the rules are. If we don't like them, we'll file a grievance. Money-wise, if we don't like what you're offering, we're fine with what we currently have available to us under the labor deal. They have worked out, most importantly, a protocol for the COVID-19 testing. The players had been pushing, Chris Sims, for daily testing. They will get it for at least 2 weeks. It may then reduce based upon how many guys test positive or otherwise. You need to have multiple negative tests before you're even allowed into the building. If you test positive, you either have 10 days or 2 negative tests before you can come back. Positive and asymptomatic, I think you got a much quicker path to returning. Positive with symptoms, it's going to be a little bit longer, but they got the basics worked out, and that's good. That's good because that was one of the primary impediments to getting a deal done. The union wanted, as the NFLPA said in a statement yesterday, strongest testing, tracing, and treatment protocols to keep our players safe. Testing protocols we agreed to are one critical factor that will help us return to work safely and gives us the best chance to play and finish the season. And that's ultimately what it came down to. The players weren't going to strike.
Right.
From the players' perspective, if at the end of the day, what gets put into place isn't good enough, what happens? It all falls apart like a Jenga tower, and you've only taken a couple of bricks out of the thing. That's what they were trying to avoid. They were trying, let me do this again as we try to force it into the Webster's Dictionary. They were trying to self-protect the NFL from itself with this. The concern was that by going maybe a little cheap, maybe going with a little bit less than what the NFL should have done,
right,
they were setting the stage for a disaster. That's how the NFLPA is characterizing this, not as the product of a negotiation. The idea was, we're both trying to negotiate against the virus. We needed the best testing in place to do it, and the NFLPA is happy with where they are for now.
Yeah, well, they should be. I mean, they definitely should be. I mean, first off, it's you know, in a realistic world, NFL football, I mean, to think that you were only going to test 2-3 times a week or something like that, I just don't know how that works. You know, I don't. And I know that, like, teams and players and everything, they're going to try to practice social distancing during practice to a degree, but it's not going to be foolproof. And, you know, again, unlike the other sports, it's more of a balancing act in the NFL. Well, of course, we know it's a way bigger roster. The training camp roster is 90 people. So within that, too, we know there's more chances. So I'm glad the owners stepped up. And I think the point you make about, you know, hey, the players, yeah, they didn't want this thing to self-destruct before they even got going, or got going and started to get into football shape, and then all of a sudden you got to take a break and get away for a while.
Wait a minute.
What?
How could you do that? Self-destruct itself. Come on, we're making a push here. You had a prime opportunity.
I thought I said it. That's why I didn't even realize it. I thought I actually said it. That's but I do think this was a huge step, and this is going to comfort players in a big way. I really do think that, and it was a necessary step. If the NFL wants to make it through training camp, not have this be over before it starts, you know, and start lumping days together, I don't see how there would be any other way to do it than the way they're going to do it here too. And the good thing is, you know, I know the owners were, like, you know, worried about the money, probably about the testing and all that, but, you know, I saw, you know, some of the protocols, right? Like, yeah, it could drop down in 2 weeks, but if it starts to pick up, right, where it's 5% of the team again, they can go back into the testing and testing every guy every day. So they've really covered themselves in a lot of different areas that make a lot of sense.
Well, and I've been trying to figure out exactly what kind of a financial investment they're getting into, and obviously it's a cost of doing business at a time when lives are on the line. But my understanding is the deal that they have with BioReference Laboratories entails 120 tests per day per team, flat rate across the league, divided up by 32 for all the teams to play. And then if there are any tests that are conducted beyond 120 per day, they cost 125 each. Now, the way business normally works, you're not paying 125 each for the first 120. It's going to be some reduced rate. Then beyond that is when you get it into 125 a day. But they're turning around the results in 24 hours or less. I still have real concerns about the NFL draining resources that would be available for the general public. And whether they're doing the actual testing and the analysis locally at a lab in South Florida, or whether they're sending it somewhere else, all the tests that they're doing for the NFL are tests that could be done for people who are actually sick. And when you consider, or at least think they're sick, I mean, nobody's just going to take, how many people are going to take a test? Like, I just feel like having a Q-tip, shoved all the way up my nose. No, it's somebody who thinks they may have it, like you recently did. You thought you may have it, so you go get tested.
And when they put me through a checkpoint, Mike, they did. Like, I had to get on the phone and talk to from my Yale, New Haven, medical hospital up here in the Connecticut area. They made me talk to a doctor and give him some symptoms, too, because they don't want people just going, oh, my eye's itchy, I need to go get a COVID-19 test, right? So there was some sort of protocol to where you just can't abuse the testing system, I guess is what I'm saying. Sorry to interrupt.
No, it's fine. There's no protocol for the NFL. All you have to be is on a team or a coaching staff or a trainer or anybody else that falls into the first two tiers of access to restricted areas who needs to be tested every day. Even if you're perfectly healthy for 5 straight months, you're going to be tested every day. The point is, there is, and it's been overlooked because I don't think they have a response to this.
No.
If they had a response to it, they'd be talking about it. There is an ethical issue here that's being glossed over regarding the impact of all of these tests on the people who can call a hospital and answer all the questions like you did in a way that lines them up for a medically necessary test. And with the virus raging, that's a real issue.
Yeah.
If it was like it was back in May, not a real issue. If it had gone the way we thought it was going to go between May, June, and July, not a real issue. When you look around and see how many positive results there are every single day in various major cities where NFL teams do business, that's an issue that I think it's just one of those things where we really don't want to deal with it, so we won't. But I think it's appropriate for us to raise the question, and it's appropriate for us to ask the question, what are they going to do to ensure that they're not keeping people who need to be tested from being tested and who need their results more quickly than 5 to 7 days from getting those results on a faster basis, Chris?
Yeah, well, I'm scared of that too. You're right. I mean, listen, I want society to heal first, right? And everybody get healthy and let's get back on the right track. I'm not, hey, like up here in the New York, New Jersey area, yeah, I'm the Jets and Giants going to be tested every day, but I don't know. We're not having testing problems, nor are we having this huge outbreak. I'm more worried about, the Arizona, the Texas, the California, the Florida teams, and you're hearing the horror stories there about how long it does take to get the test and the results and things like that. But, again, this to me, yes, it seems maybe a hair insensitive by the NFL and the players, but I don't know. When the federal government doesn't get involved and leaves it up to the states and things like that, this is the stuff that happens. So, money talks, BS walks, and the NFL's got money, so they're paying a lab to do it all by themselves, and they got their own little lab to do it all. And that's not right. You're right. It's not right in our country. But, the reality is right now in our country, that's the way it is. And I don't know if anything's going to change it at this point.
And football fans would say it's justified to have those resources diverted to NFL players because we need football and we want football and we need the diversion. And that's fine. Football fans can take that view, and I'm inclined to take that view. The reality is there's still a lot of people in the country who don't care about football and care more about themselves, their family members, their friends, people who may have COVID-19, and there's an urgency to find out so those people can be properly treated and properly kept away from others that they can infect. So it's not an easy question, and the easiest approach so far for the league and the union has been to ignore it.
Hi, I'm Mike Tirico, and thanks for watching. Make sure to hit subscribe for the latest news and highlights from NBC Sports.